This is Dr. Supreet Shah at Truspine San Francisco Clinic. Today, Graston Technique is a form of manual therapy as soft tissue instrument assisted mobilization. It is, the number of many different manual therapies that we use within the clinic. The specific therapy is done using a steel instrument at different body parts depending on where the injury might be. Now, we have about 6 different steel instruments that we would use at our clinic in San Francisco. One of those may be a smaller sized one for, let's say, a wrist or an ankle joint. Another one may be used for a bigger muscle, such as the hamstring muscle or one of the back muscles. At our clinic, in San Francisco, we do use other soft tissue techniques, but this is one of the more predominant ones that seems to help a lot of our patients. Graston Technique is essentially there to break up scar tissue and fascia restrictions that are usually done for trauma injuries, but also just your day-to-day injuries as well. It reduces restrictions at the connective tissue level. When we do break up the scar tissue, your body will naturally dispose of the scar tissue that is broken up. So it goes from crisscross fibers, breaking that area up to get more aligned fibers so that the joint moves better and your function flows a little bit smoother. Say Graston Technique is painful compared to other therapies where a provider may use their hands. In fact, it may be even less discomforting to use more of the Graston Technique because it's very, very specific and it doesn't go beyond the edges of where your injured area may be. Graston Technique can be performed at once a week. Sometimes we are a little bit more aggressive with the therapy, and it could be done also twice a week, depending on the patient's tolerance. Graston Technique can be done on a very specific timeline, depending on the type of condition the patient is coming in with. When it's more of an acute condition, we may see the patient, a little bit less frequently to give them some space and time in between each of the sessions to heal. But it's not uncommon to see someone using the Graston Technique for just a day-to-day chronic condition where we may even see them on a daily basis to again get in there and break up the scar tissue. Yes, it can be definitely compared to muscle scraping, which is another name that some providers may go by. That one sounds a little bit more intense. I like to think of Graston Technique as a more milder therapy compared to some of the other types of soft tissue therapies out there. Graston Technique can be done, for any age demographic. It really comes down to the type of injury the patient is coming in for. If a patient comes in for more a soft tissue injury, Graston Technique is definitely very applicable, but it can be done for a variety of other conditions outside of soft tissue injuries as well. Graston Technique may cause side effects such as bruising at the area that was treated. Now, this is a very temporary, or transient type of observation there that can last for, a few hours up to a few days and even up to a full week. The idea is that we're breaking up scar tissue and capillaries in that area, which causes the bruising, and it brings more attention to that area of injury, so your body knows, okay, I have to heal this specific spot, and brings more attention and focus to that area. Graston technique can definitely be used for a variety of conditions. Most patients know Graston technique to be used for more soft tissue injuries, such as plantar fasciitis. And plantar fasciitis is, again, sharp pains that are typically felt at the bottom of the foot. Again, can affect a wide range of the demographic of the types of patients that we see. The Graston technique, again, is using a metallic tool to get into the muscles at the bottom of the foot, in this case, of course, to the patient's tolerance, breaking up any scar tissue and the fascia underneath there to help increase local circulation at the area that's injured. And we've noticed that and observed that the Graston technique has really sped up the recovery process for a lot of our patients who suffer from plantar fasciitis. And we still are offering this type of therapy at our clinic, Truspine in San Francisco. Most people see Graston technique as treating soft tissue, but it could also treat a lot of other conditions that may not come to mind at first, such as arthritis. Now, Graston technique doesn't cure arthritis, but with an inflammatory condition like arthritis, there's a soft tissue component that Graston technique can address. Again, breaking up any sort of tightness around that inflamed joint can really help. Other conditions that Graston technique can really help with, tennis elbow, golfer's elbow, tendinitises, and again, plantar fasciitis. Graston technique typically doesn't have too much of a downtime. It just really depends on the type of injury. Of course, with acute injuries, there's going to be a recovery period. With more chronic injuries, such as plantar fasciitis and tendinitises, movement is usually a good option in conjunction with Graston therapy. So a lot of times at the clinic, we may have the patient warm up a little bit before performing Graston technique, and then after the Graston technique's performed at that specific area, we may have the patient move around a bit. So if we're performing Graston technique at the bottom of the foot, post treatment, we may have the patient walking around and getting things moving a little bit to get the flow going. Now, there are a lot of tutorials and videos out there that are promoting Graston technique at home. I personally would advise against performing the Graston technique at home. And the reason being is because the professional that you'll be going to that is trained in the Graston technique will know exactly which muscles to really connect with and which ones to work on. Sometimes we may see injuries from self-Grastoning at the tendon, at an exposed nerve, and these are things that your provider will be trained in how to look out for. So again, I strongly urge that patients seek out a professional that's trained in the Graston therapy to provide that type of therapy. For example, we had one patient who was a very avid runner suffering from something called ITB syndrome, or iliotibial band syndrome. We used the Graston technique on the IT band for this particular patient. I would say for 10 to 15 minutes per session for a total of 8 sessions. This patient was ITB pain free by the time the 8 sessions were complete. And this is typically what we see in terms of the prognosis and the length of time for a patient suffering from a soft tissue injury to get better, between 8 to 12 sessions, pain-free, and then of course maintenance after as needed. Also, we got a lot of questions about the cost and how does this factor in? Does insurance cover this? I would have to say, yes, it does, because most insurances will cover a manual therapy portion of your treatment, which is covering the Graston therapy, which falls under soft tissue or manual therapy. Otherwise, we do also offer very competitive packages for the Graston technique at our clinic. Please call us at 415-421-9700 1115 to find out. And if you have any questions, I'd be happy to answer them.